Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Well, my name's Helen Penne. I'm currently 38 years old. I was born here in England but had a slightly different upbringing in life. I was brought up in Africa as a child, so my life was quite varied and quite wild really, with the wild animals and everything. But came back to England at about the age of 11 and continued the regular education. Myself, my brother and my parents, and eventually left school and went down the route of being a funeral director to start with. And as I got older, I ended up as a forensic scientist. And I've been doing that now for the last 16 years. And I like to ride motorbikes. I'm a biker, and I like to go on bike rallies and enjoy outdoors. I used to enjoy shooting, but the last couple of years I've given that up. So sort of a fairly active, lively, outdoors kind of a life within reason. But I don't drink, I don't smoke, but I still manage to enjoy everything that everybody else manages to enjoy. That was until up to 2012, when I was diagnosed with squamous cell carcinoma in the left cheek of my inner mouth.
So Helen has come in today. Thanks for coming to give your story about what's happened to you. And can I say for the viewers that you've had a cancer diagnosis, mouth cancer?
That's right.
Which is squamous cell carcinoma, they call it.
That's correct.
How was it picked up initially?
Initially I thought I had a mouth ulcer, and that was back in 2011, latter end of 2011, and several tubes of Bonjela later it hadn't resolved itself, and by February 2012 I had a routine dental appointment, and that's when the dentist decided to send me on an emergency appointment to the LRI, to the head and neck clinic, the maxillofacial clinic, to have it looked at.
And did they suspect there was a cancer, or did they just go along with investigations for a while and you found out later?
I'd unfortunately had several skin cancers in the past, and I'd had several surgeries, minor surgeries, on the left side of my face. And I had already, by the time sort of the appointment came round, had suspected that it was something that was a bit more untoward. And the hospital, until test results came through, weren't prepared to say anything whatsoever.
Yes.
And it's understandable.
They normally don't like to say too much, do they?
No.
In those early stages?
No, not at all. So as much as I tried to push and say, you know, oh, I think that it may be this, what do you think? It was, let's wait till the test results come through, which was a little frustrating. However, that's the way they have to operate, and that's fine.
And what did they say then when the results did come through and you came back for those?
They merely confirmed that I had a squamous cell carcinoma, and there were some more, you know, they'd need to do some surgery, and at that point they didn't say what surgery they had to do. And because I'd had several of these cancers before, but on the outside of my skin, I automatically assumed it was going to be a local anaesthetic and cut it out, oik it away, a few stitches, a couple of days later and away you'd go. And at that they sort of started sending me off on several tests for wrist x-rays and scans, and it's at this point I thought, why on earth would you want to do something like that, just to oik out a small cancer, you know, that I'd had some of before. So I started asking questions, so why am I having these tests done, to the people that were doing the tests, and they says, oh, this is what we have to do before your surgery. And I just got more and more confused. And it was an unfortunate circumstance that I had to go and see the anaesthetist. They said I'd be put to sleep for this one, which I was fine with. And I had to go and see the anaesthetist, and the anaesthetist had the unfortunate job of having to tell me what surgery they were going to do, which wasn't actually his job. And he felt more uncomfortable about it because he didn't normally have to do this. And that was when the shock came as to exactly what it was they were going to do. And before I saw the anaesthetist, I was meant to have been told by the surgeon what they were going to do and how they were going to do it. But unfortunately that hadn't happened. Mistakes are made, these things happen. It doesn't really make any difference in the grand scheme of things. And that's when the bombshell hit, really.
And you were facing then not just your diagnosis, but that big operation,
yes,
which was an unknown to you at that time.
It was a very frightening unknown, yes.
And what actually did you undergo then with the surgery?
With the surgery, they removed the whole of the inside of my left cheek and all of my teeth, top and bottom on the left side, and my gums, and they also took away some of my tongue on the left side as well. They then took away all my lymph nodes from my neck, and because they'd taken all this away, they had to plug the hole, if you like, with something. So they used a flap from my arm with all the veins and arteries, and sort of plumbed that in and closed all the hole with that, and then took a graft from the top of my arm to heal the bottom of my arm from there.
A big operation?
Massive, 12-hour operation,
really?
Yes.
How long did it take for you to recover from that physically, as far as you can remember?
I'm still recovering.
Really?
Yes, 10 months down the line, yes.
What were the residual effects then that you were battling with, even though you came through the operation?
Physically, if somebody said to you, when you've had 12-hour surgery, you're never going to get up and walk for a couple of days, you can't possibly imagine it when you've never been through that. When you're 37, at the time I was 37 years old, and you're fairly fit, you're fairly healthy, you're fairly active, and to somebody to say that you're not even going to be able to lift your left arm whilst you're lying in bed, you can't possibly imagine that. They don't actually tell you that. They just tell you you're going to feel a bit rough for a while. Rough's an understatement. Hit by a bus is probably a better description. But it's perfectly normal, absolutely normal. But it took me a good 3 days before I could physically get out of bed, but even then that was still very much aided. And it must have been day 4 or 5 before I could shuffle anywhere to do anything, and that's 2 or 3 steps. And then that's it, you're completely wiped out of all forms of energy whatsoever. You just can't possibly comprehend how difficult basic functions in life are, and that takes a very, very long time, even though you're young and fit and healthy, to regain any kind of ability to be able to do anything for yourself.
Did you feel that fatigue lasted a long time?
Yes, still there now. I now understand and am led to believe that somebody of my sort of age and my sort of fitness, it's not unreasonable to expect a good 18 months before you're beginning to feel anything like back to what you were. And for some people, even younger and fitter than myself, that never comes and that never happens. But that's just the unfortunate side effects of surgery, and you have to find a new way of life. You have to find a new normal, you have to find a new existence for yourself, and you have to stop beating yourself up about it and accept that this is my limitations now, if that comes about, and get on with that, you know, and make the most of what you have got. So I'm still going through that. Say I'm only 10 months down the line myself, so I'm still going through that myself. I'm still rebuilding my strength, but I've got the determination and the drive to get there, because there's too much in life to live for.
So you told us about your extensive surgery, and
Yes.
Clearly that was a major operation, and
Very much
took
so.
some time to even begin to recover from that.
Yes.
But I wonder if I can address an issue which is quite a sensitive one in a way. How you feel about the change in your appearance.
Okay.
Because, with mouth cancer or head and neck cancer, a lot of the issues revolve around how other people see you and
Yes.
how your confidence is. How did you feel, one, the cosmetic result was after the surgery? And two, how did you feel that other people were relating to you later when you were back home?
On the ward that you're taken to recover for a couple of 3 weeks, there are no mirrors. And whether that's intentional, I don't really know. However, I think when your family and friends come to see you, one of the things they all said was, I expected you to look a lot worse. Now, at the time when I came out of surgery, my face, neck and shoulder, there was no definition. It was just one mass, a complete mass, and there were more tubes than you can possibly imagine coming out of places you never knew they could put them. And you don't really know yourself what you look like, and there's 50% of you that wants to see what you look like, and the other 50% of you thinks, is this going to do me any good whatsoever? And during that period of time, you've got time to think so much about things, and you have a choice. You can choose to think, oh my God, what on earth is going on? Am I going to look like this for the rest of my life? I look like a freak. I don't want anyone to see me looking like this. Or you can say, this is temporary, this is going to get better. It may not return to exactly the same as what you were. You may have scars, they may be there visible for life, but I have a life. They have given me a life. And that is precious.
In a sense, what you're describing is almost like a trade that you make. You are being given another chance, and the cancer's being either defeated or put back. But there is a cost to it, which is all the operation, all the changes to yourself, the changes to your lifestyle and appearance, which you can't fully anticipate. You can't fully anticipate before.
No.
You're having to live with after the fact. But can I say that from an observer's point of view, the change in your appearance seems slight to me? In other words, the cosmetic result seems good.
Yes.
I know you've had that chance for recovery, but does it feel that way to you?
When you look in the mirror, you can make a choice, and you can choose to concentrate on that area of change, or you can look at the bigger picture. And it all depends on your mindset and how you choose to look at yourself. You can choose to look at yourself as a freak, or you can choose to say, yes, there's still a little bit of swelling here, but in the grand scheme of things, I'm only 10 months down the line, and there's not that much to look at anymore. You know, in the earlier days when I first started getting out and about, I looked like something from outer space, I really did. And you'd stand in the queue at Tesco, and you know, children are just little sweethearts. They say what they think, and you know, they'd be tugging on mum or dad's shirt saying, "Mummy, mummy, mummy, why is that woman got a great big fat face?" You know, and you can either get upset about it, or like me, you can laugh. You know, and there's mum going, "Shh, shh, shh, don't say that, shh, shh." And inwardly, I'd just be killing myself laughing, you know, because kids are kids, aren't they?
Yeah.
You know, but ultimately, when you're out and about, and you may look different to what you did before, you look different for a reason. You look different because you've had a condition or cancer or whatever it is that has caused this to happen. It is not necessarily your fault. And you've been given an opportunity to recover from that, and that's what you're doing. People don't look at you as going, "Ooh, there's the freak." They don't do that. People mostly look at you and they empathise with you, and they also think you've got courage to stand there and not be bothered about what other people think. And that's the way you should be. You should stand there with your head held high, if you physically can, and be proud of the fact you've been given this opportunity. And that's the way I feel. It doesn't matter what you look like, you're still a person inside. People think more sympathetically towards you and have empathy towards you than they do go, "Ooh, look at the freak." That just doesn't happen. You know, you've got nothing to be shy of, nothing to be ashamed of to go out in public. I didn't wear any makeup. I didn't care what my hair looked like. I had this mass that was probably out here for a very long time, and when it's cold my face still swells and can come out quite some way when it's cold, but you know, I'm here, and that's the bit you have to concentrate on, not the negative bit. There's a tiny little negative bit, but life is a big bit, and that's the bit you should concentrate on.
Yeah, that's great to hear that. So yes, that's interesting to gauge also how you're progressing from the reaction of others in a way, and the reaction of others was generally not too negative on most occasions. Not at all.
In fact, the time I found the most bizarre, when I was still in hospital, you were being wheeled from pillar to post all around the hospital. The visitors and the other patients generally didn't particularly look at you very much. You know, most of us have been brought up, don't stare at people, and the people that tend to stare at you the most were actually the nursing staff. And whether that, you know, most of them had the biggest shock on their faces, going blimey, whether they're wondering medically what on earth that poor bugger had done, I don't really know. But I found they were the ones that sort of stared the most, and that again, that amused me. And of all the people in the world, you'd have thought they'd have been used to seeing some pretty ghastly sights. You know, initially you've got staples all round your neck, looking like Metal Mickey with a zip round your neck. You know, and they stared the most, but the public, you know, the public were generally very kind, you know, and very empathetic.
Did you ever have a problem going out? I know you did face those kind of fears and the unknown by going out, but was a bit of you nervous about going out initially? Because you know, like you say, things were very difficult at that early stage. I
was more concerned about physically managing going out, because even though I was they tried to set me a challenge before my surgery to try and, I was young, they wanted to get me out as quick as possible, they wanted me to recover as quick as possible, they want, you know, they're very keen to try and get you to get back on track with your life, because you're young and you have a life, and you've got the rest of your life to, you know, you've got to deal with. And they set the challenge saying, you know, the person we've had out the quickest was 2 weeks and 2 days or something like that, and want to see if you can beat it, you know. Well, I'm not the sort of person, I'm not competitive, I'm not in any way, shape or form, but they happened to get me out 1 day short of 2 weeks, which was great. Good. However, for me to be able to do that, I had to have constant care at home, which is where my mother quit her job and came and lived with me for 5 weeks. And during that 5 weeks, the physical effort to actually get out of the house, get around the house, is astronomical. The first time you climb a set of stairs, you know, you find it hilarious. Well, I found it hilarious when the physiotherapist came round saying, right, we're going to climb a couple of stairs today, and you think, I'd do that 2 at a time, even at my age, you know, and you think, yeah, okay, by which time you're having a good shuffle around the ward and you're thinking, stairs are nothing, you know, what on earth you want to take me upstairs for? Yeah, so you'd shuffled out to the landing and there's your stairs, and you wouldn't believe, it's almost like you've either hit a brick wall or someone's trying to push you back down the stairs to climb those first couple of steps. And I couldn't do it for laughing, because I couldn't believe how you physically feel and how you couldn't lift your legs, because there was lead weights at the bottom of each one to climb those stairs. So that takes a long time for your body to be able to do that. So even when I went home and I didn't have a downstairs toilet, so to go to the toilet I would have to go up the stairs, and the physical effort involved to just get up and get your 40-sip drink to inject, because I had a tube for feeding for many months, because I was nil by mouth for a good 4 or 5 months.
That's an issue.
So, you know, to do that, if my mother wasn't there making me do that and fetching that for me and literally putting it on a tray in front of me, and on some days I didn't have the strength to lift my arm to even pull the syringe back to inject myself, so my mother would have to do that, and that's quite normal. Even at my age, I can't imagine being 60, 70 years of age and having to do that when you've got age against you as well, and perhaps not quite so physically fit. And I just can't imagine what that must be like. But, you know, I'm now understand, and I now realise that you can't beat yourself up about these things. You have to go through this, and you have to accept. Accepting is such a relief, really, once you learn to accept that you are physically capable of doing what you can do right now. You physically look like what you look like right now, and it's going to take you at least X period of time, a year, 2 years, to begin to feel back to the old person that you once were. And once you've accepted that, you're going to find life so much easier and so much better. And 99%, I'm sure, 99% of anyone's difficulties, no matter what they are, if you accept the way things are right now, the future will come much quicker.
But there's another side to that. Although accepting it is important, pushing yourself forward and doing a little bit of something, like you were saying, the effort maybe to go to the loo when it was upstairs could actually pay off, because you're doing a little bit more than the average person, if you like.
Yeah, you still have to also accept that you have limitations, and you do have to push yourself, and you do have to make yourself, and 99% of that is in your mind as well, because you go through a huge period of time of woe is me. You go through a huge period of time where you can't be bothered. You don't want to do anything, you don't want to speak, you don't want to be with anybody, but then you want company, and then you do, then you don't, and you go through huge periods of time. You spend day in, day out crying for no apparent reason, and you go through all of these periods. But to get past them, yes, you have to push yourself. You have to have that desire to want to do it, and without that desire to want to do it, it's not going to happen. So yes, you have to push yourself within the limitations.
You mentioned another issue which I think is difficult for many people, which is the changes to your eating pattern, drinking.
Yes.
You know, basically around food. So you were nil by mouth for quite a long time, which means you weren't allowed to eat anything orally.
No, or drink.
Or drink.
No.
What was that like?
Pretty rubbish. It was quite surprising and quite shocking as well, to a certain extent. I thought, and I was bothered that I'd be hungry, and beforehand I thought, oh, you're never going to be satisfied on a liquid diet, you're going to be starving, you're going to have food rage, all these things, but you don't. Food, I mean, they didn't start feeding me at all until 3 days after my surgery, and yet I was never hungry. And the entire time I was in hospital, every time they tried to feed me anything whatsoever, I would throw it up every day. So the time I actually got home, I still had a bit of this, you know, you would inject a small amount of food, unfortunately you'd be sick. And eventually your body settles down to this and it gets used to it. And if it wasn't for my mother forcing me to have my 40-sip drinks when I was supposed to have them, I'd probably have sat there and not bothered and withered away somewhere until somebody probably dragged me back into a hospital, because your motivation to want to inject something that you can't taste, you can't enjoy, you don't care about, you have no sensations or feelings of feeling hungry at all. There was no desire there whatsoever. And even when they turned around and said, you can now attempt to start trying soft things, your custards and your yogurts and your things like that, the desire had gone. And I was amazed how quickly that came about. And I can see really why people become anorexic so quickly, because that desire to eat and that desire to consume any food whatsoever completely went. So when I was supposed to start eating, I didn't want to. And for a long time I continued to inject when I wasn't supposed to, and I was supposed to be trying things. Eventually I knew I couldn't continue like this, and eventually I had to kick myself at the backside, and eventually I started trying these things, and I didn't get on very well with it at all. I'd lost my sense of taste. I didn't like anything that I used to like before, and that took months and months of forcing myself again to continue to try things. Some things I still don't like. For example, shockingly, chocolate. I don't like it anymore, which has no massive problem really in life, but you know, shock, horror, Helen doesn't like chocolate. What's that all about, you know?
So you did like it before?
I loved chocolate before, like everybody else.
What is it about it now?
I don't like its consistency. It sticks to my flap. I just don't like the flavour anymore. I don't like anything too sweet anymore. I can't tolerate sweet things. It almost feels like it burns my mouth. Sugar seems to burn my mouth a little bit. Anything bitter, I can't tolerate anything bitter anymore. Before I'd be one of these people where, you know, you'd have a lemonade with a blob of lemon in your drink, and I'd be one of these people that would suck on the lemon after and not even pull a face. Now I can't go anywhere near it.
Does that apply to any kind of strong spicy food? Or
no, as time's gone by, my taste has changed again, and some of the things I used to enjoy I can now enjoy, but anything hot and spicy, as in heat spicy, I can't tolerate at all in my mouth. I say anything bitter and anything too sweet, anything with pure, you know, crystal bits of sugar on it, I can't contend with it at all. So yeah, food has changed things, but again, it doesn't matter. You find a new way of living, and a new way of living, and the new life becomes normal. And it doesn't take long before that becomes the new normal. But you know, you can wallow in it, going, oh, I want to be able to eat chocolate again. Who cares? It doesn't matter. You know, find something else you enjoy.
Yeah, definitely. Helen, let's come on to any other issues that you feel were important in relation to your recovery from that big operation and those weeks and months at home as you were trying to get back to normal. What were the main issues for you at that time that we haven't mentioned yet?
I think work actually was quite a significant part. I mean, I know a lot of people, or I've been told by my surgeon, that the majority of people that they see are usually people of nearing retirement or retirement age, and it's unusual to have younger people with the sort of surgery that they've had to do. So for me, you know, there's a whole new ball game. When you're retired, you can take all the time in the world to recover, and but for me, you know, you have a set policies at work, and I was no different.
Yes.
And for me, the policies were that you have 6 months full pay, statutory sick pay, and 6 months half pay, and then you don't get paid. And when your surgeon's saying, you know, it's going to take you at least a year before you're going to recover, you live on your own, you have no other financial income or support, you have your mortgage to pay, your bills to pay, and you can't do that on half pay. So for me, that was actually far more stressful and far more upsetting and worrying, and that really hindered my recovery.
Yes.
In a very, very big way. I became I was doing really well up to the 6 month mark, and I was way ahead of where a lot of other people would be in terms of recovery. However, I physically had no ability to be able to do any form of work whatsoever still at that point. So, you know, for them to turn around and say, well, sorry, tough, you've had your 6 months, you're going on to half pay. Well, for me, that meant I was going to lose my house. I'd have nowhere to go, no home to live in, and that stress just made me 10 times worse. It set me back a good 4 months. And I was in such a worse state that thankfully my workplace recognised their responsibility, and I understand that this doesn't happen in many workplaces, that they said we will grant you another 3-month extension to your full pay. And I was very fortunate with that, but they could see that they had a responsibility, and actually they knew that they were going to make me homeless. They and being a single person without any children, I was entitled to absolutely nothing. There are no benefits whatsoever, and they expect you to pay your rent or your mortgage on £71 a week on the government's grants of what they, you know, or what they'd give you, or that's what you're entitled to before, you know, they will give you anything whatsoever. Well, it's just not realistic. It doesn't happen. It's not realistic. So that made me incredibly poorly, and set me back mentally and physically in a big way. So that extra 3 months really helped me.
Did you get any advice from the financial point of view around that time?
Yes, I was put in touch with the financial Macmillan nurse for a Leicestershire area, and she was fabulous, absolutely fabulous. She did everything she could. I mean, because I had my surgery in the August, and surgery, when you've had major surgery, you are constantly cold, permanently cold. Even now, you know, sometimes on a warm day I can, you know, unexplainably be cold, but that's quite normal. But because I had mine in the August, winter soon followed. I had an old house with an old back boiler. The energy bills, the heating had to be on permanently, else your face swelled right up again, and you were just, you'd make yourself ill through trying to be cold, you know, trying to keep yourself warm. So Macmillan nurse, bless her, managed to get me a small grant to help me with my heating bills. And she also looked into any housing benefits that I may have been entitled, any benefits whatsoever that she looked into. Unfortunately, there weren't any, no children, no benefits, and that's what it boiled down to, unfortunately.
Okay, so that was an added stress, if you like.
It was a stress I didn't need at that time.
How did you feel overall you coped emotionally with the whole cancer experience?
It varied really. In the very beginning, your friends and your family and everything, they were very much, right, let's fight this, let's run, they had all this, come on, we're going to fight it malarkey. And I didn't have a single fight in me whatsoever. I didn't have the desire to die. I didn't have, you know, I didn't want to give up, but they were just rallying round and going, right, you know, and I couldn't understand why I didn't have it. I just wanted to go along with the flow, because the fear of everything unknown was huge. I didn't have that in me, because I was too busy going, oh my God, what the hell is about to happen? I'm about to have this tracheotomy, and that completely blew my mind. I didn't sleep before the surgery. I mean, I don't drink, but the weekend before my surgery I went on a bike rally and I got completely hammered. All weekend, absolutely hammered. And I asked if I could, you know, was it going to affect my surgery if I had an awful lot of alcohol the weekend before? And bless her, the nurse said, you know what, knock yourself out and go and do it. So I did. But the fear factor of that tracheotomy, I had, what affected me more than anything subconsciously was all these television programs. You have all these medical programs where you see people having difficulties breathing, waking up from surgeries with tubes in the mouth, choking, you know, and all that sits there in your mind playing silly games with you, and then somebody tells you that you're going to have this plastic tube shoved down your throat. And oh, don't worry, it's just a minor irritant. You can't possibly imagine it. And you imagine the worst case scenario. And you cannot, no matter what anybody tells you, and to be quite honest, there's not a lot of people that tells you much at all. They just tell you you've got to have it because your airways are going to be swollen. You know, you'll be fine, and that's all they tell you. And you think you need a bit more reassurance than that, you need a bit more comfort than that. But actually, everything that I was frightened about and everything that happened to me, in the grand scheme of things, when you look back, never was as bad as what you imagine it to be.
Yeah.
Yes, the trachea wasn't nice, and yes, it was an out-of-body experience almost, but it was never painful. I could never not breathe. Yes, you get a bit chesty. Naturally, it causes, the trachea itself causes a small irritant and causes extra fluid within your lungs. But you learn how to get rid of that. You learn how to ask for help with that. And there's ways that they can help make things better. And it wasn't as bad as what I thought it was going to be. It's not something I particularly want again. But if they said to me, I'm sorry, tomorrow we've got to do it again, okay, I can do this.
Yeah, that's an important marker. You know, if you could face it again,
yes.
You've already had it.
Don't want to,
no,
but if I had to, I'm not going to have the fears that I had before.
That would also tell other people watching, you know, that it is possible to go through with it without quite as bad an outcome as they may fear.
No.
And,
so that was sort of prior to the surgery. That was my biggest fear. And as I was admitted the night before my surgery, a new fear developed very rapidly, and I didn't sleep that night at all, and I don't probably suppose many people do really. And I just suddenly thought to myself, what if I don't wake up again? You know, there are no guarantees, despite the fact the anaesthetist said to me, you're young, you're fit, you're healthy, you don't smoke, you don't have any medical problems that would affect what we're doing. You know, if I was to give you a percentage risk factor, he says, I can't give you 100% you're going to be fine. He says that I can't guarantee that. He says, but I will give you a 1% risk factor. You know, you think 99% I'm going to be good. No, there's a 1% risk. That 1% risk in your mind becomes 5,000%. You know, it gets blown out of proportion. And that night before my surgery, when I was pacing around in my room, tossing and turning in the bed, slatting around, slatting things about, I felt that night I was walking myself to my own death. And I thought, this is ridiculous. But you get wheeled down to the theatre that morning, and then the bed must have been like there was an earthquake, because I could not stop shaking. I was so frightened, and then they stop the bed in the corridor and make you walk the last 100 yards, and I absolutely genuinely thought I am walking myself to my own death. And I felt the nurse's sort of hand in my back almost pushing me, because I'm sure I must have been resisting. You know, sort of, if I could have put my hands and legs on the door frame to stop myself going in, then in my mind that's what I was doing, you know, and I felt I was walking myself to my death. And that had such a profound effect on me, and that affected me long after my surgery. I had this overwhelming fear of the theatre, and that manifested itself into a need to know, and a need to understand what happened, because it's almost like a day of your life's missing, and I had no idea what happened during that time, although I knew I was asleep. I had, you know, this day was missing, and I had to walk myself into this awful place and put myself through this awful fear, and that just manifested itself and got worse and worse and worse, to the point that I ended up writing to my surgeon and saying that I want to put this right. This is driving me insane. I would be crying all the time. I would be a complete state about it all, and completely upset about it all. So I wrote to my surgeon and I said, look, I'm terrified of this theatre. I knew I had to go back to at least have my tube out. That was the very least I'd have to have done, and there was no way on this earth was I walking back in that theatre. That tube could stay there for life, as far as I was concerned. I was not going back in that theatre, and I thought, this is ridiculous. They're doing this for my benefit. They're doing this to make my life better. But that fear was just consuming my life, totally consuming me. So I thought, I've got to do something about this. I've got to turn the fear into something positive. And it took me months to work out how to do it. But eventually I wrote to my surgeon and I said to him, I'm a day missing in my life. I've got to come back to theatre. It's ruining my life. I want to change it, and I don't really know how to do it. But all I can say is, can you spend some time with me and tell me specifically what happened that day? What happened in those 12 hours that I was out cold? What did you do? How did you do it? I'm medically quite a curious person anyway, having been an undertaker in the past and an embalmer in the past. So, you know, medically I was quite a curious person anyway. And I thought, maybe if by any remote chance somebody could take me back to that theatre and show me around the theatre and show me, you know, that this is the equipment we use, this is how we did things. And I thought, if I can turn the fear into fact and information, then maybe the fear would go. And until I tried it, I didn't know. So I wrote to my surgeon and asked him to do this. And I was amazed that he spent an entire afternoon with me. And he sat there and he explained the science behind what he did, the history behind what he did. And then he took me down to the theatre and he showed me all the equipment that he used, how they used it, what it's all for. And it just did the trick. I have no fear. And when I did go and have my tube taken out a couple of months ago, I skipped into that theatre, laughing and giggling, as I always am.
Yeah, that's quite amazing.
And I had to change it. I couldn't spend the rest of my life living like that. So I made sure I changed it.
So that's a very good tip, not just for the patients, but also for the clinician who is wondering how to help somebody who's stuck when they're coming to
not
hospital.
everybody. They can't show everybody around the theatre, or, you know, but maybe when you are going through exceptional surgeries, you know, there must be somebody that could do something like that.
There is a way
to
do it, and that's either pre-record a little tour, which people can watch online.
That would work.
Or do it via a group with a, let's say, a nurse or coordinator.
Yeah.
One of the volunteers could do it.
It certainly did the world of good for me.
It's a form of desensitization, which means you're getting used to a hard aversive experience.
Yes.
For you, they went beyond the call of duty and really showed you around, because you were really struggling. But I think there are lessons there for everyone.
Yes, definitely.
So it's useful to hear. You mentioned your employment, your place of work.
Yes.
There's another job you've also done recently, which was, I think, as a forensic scientist.
I'm a forensic scientist now, yes.
How did you find the experience of those two employers? And how did you find that influenced how you were coping with the cancer, working in the funeral home and then working as a forensic scientist?
Well, when I worked as a funeral director and an embalmer, that was back when I was an 18-year-old. As a funeral director, you see another side of life, and you see the grief and the devastation that death brings. And that was something I was very, very conscious of. You know, even though this 1% risk factor was blown out of all proportion in my mind to something ridiculous, I felt that because of my own experiences of seeing families having lost young children, loved ones of all sorts of ages, and I've seen how difficult that is for people. If that was going to be me, I wasn't prepared to put my parents through that at all. So I arranged my own funeral. And selected my own hymns and did all of that sort of stuff. And one of my closest friends happens to be a funeral director now with his own company. So I gave everything to him and told my dad that should I not survive, that's where he's to go, and they've got nothing to do. Because I know how difficult and how hard that is for people at that time. And I didn't want my parents to have to go through potentially losing their daughter and then have to do all that as well, because that's just, it's crap. Absolutely awful and shocking. So I decided to take that burden away just in case. Thankfully it wasn't needed, but I couldn't put them through that as well.
Do you think you were able to do that because of your personal work experience?
Yes. It's not, I mean, people can arrange their own funeral if they want to. There are organisations that will do that for you, and you know, there's nothing wrong with doing that at all. You know, there's nothing wrong with being organised. People do that as a matter of course anyway. You know, so you can do that, but it was something for me that, because of my own personal experiences and because of having seen some atrocities over the years, there was no way was I going to put my parents through that. No way at all.
Of course, there's another side to this, which is one that people don't necessarily always talk about, which is to even think about that, yet alone arrange it. It shows that, in a way, you're able to contemplate your own mortality in a very practical way.
Yes.
In other words, a lot of people, obviously, even in the context of having a severe illness, they don't want to think about that final worry of theirs of not being around, of dying, and that can remain a sticking point for them. Do you know what I mean? Because it's never addressed, and they never want to speak about it.
A lot of the time, when you're the person that's poorly, or you're the one facing some major surgery, and there are no guarantees, they can't give you guarantees, you know, especially when you've never had surgery before. They don't know how your body's going to react to the anaesthetic. You know, so this is why they can't give you any guarantees.
So that raises an interesting issue, which is that you were able, by virtue of making some plans and thinking about your funeral, to contemplate your own mortality.
Yes.
And it's striking that, you know, most of the public don't really want to think about it, and even when people are unwell, you know, often people are scared to think about that final fear of not being around, and you know what might happen.
There's a lot of people that are frightened of dying, and frightened, it's all, I think predominantly it's all fear of the unknown. And in my experience, I'd come to terms I only had a very short space of time really between diagnosis and surgery. It was a 3-month window, or just less than 3-month window. But in that time frame, I'd already come to terms with what will be, will be. There was nothing I could do whatsoever, even though the family were, oh, let's fight, and doing all this fight thing. And I didn't really know where that came from myself, inwardly, that, you know, I thought you can have a fight attitude all you like, but once that anaesthetic's there and you're asleep, there is nothing you can do about it, because when you are actually put to sleep, there is nothing. There is no dreams, there's no thoughts, it's just a blank hole, there is nothing. So should, God forbid, something happen to you on the table, you would know nothing about it, absolutely nothing. But you don't know that prior to your surgery. You only know that, you know, after you've woken up and you've thought 12 hours have gone and there's nothing there. You know, but beforehand I'd come to terms with the fact that what will be, will be. And all around me I found that my family and friends didn't want to talk about what if. What if I didn't survive? And they saw that, rather than me wanting to be, because of my past experience and my past history, I could almost detach myself a little bit from the situation and say, okay, let's look at this on a practical perspective. I've got 4 little dogs, they will need a home, and people saw that as me being negative, me not fighting. Well, it wasn't true. I didn't have the fight that they wanted to have, because that made them feel better.
Yeah.
But I had no desire to die. I had no desire to leave this planet and disappear off wherever we go. But I wanted to be practical, and in the end it was something I did completely on my own, because, you know, parents don't want to talk about, you know, if something happens, what are you going to do? I have a car, I have a motorbike, will you please sell them? Would you use the money for this? Would you do that? They didn't want to hear it. They just saw it that you're being defeatist and you're being negative. So, and I found that to be my experience, that the friends and family around you chose to look at it that you were being defeatist, and that wasn't the case at all.
For those that don't have that fighting spirit as an individual, you know, the fighting spirit is I'm determined to beat this, and I'm going to prove a point. If you don't have that overtly, are there different coping styles that people can use that are still effective, do you think?
There were so many things about my journey that I didn't cope with. And at the time, you think, you know, there's this typical British stiff upper lip thing, you know, you've got to pull yourself together, you've got to have a grip, you can't be seen to be crying, you can't be seen to be upset, forget it, do it.
Yeah, they call that stoicism in the literature, not really showing your feelings so much.
Yeah, and that's a very quintessentially English thing to have, and you know what, it's a destructive thing to have. The more you grieve for these things that have upset you and these things that have been difficult for you, I think the sooner you're going to get through that process, because all you're doing is containing them, and all you're doing is wrapping them up in a ball of cotton wool, and they're just festering there. You're not actually dealing with them, you're not bringing them out in the open. And for me, you know, there were people that says, oh cool, come on, let's not be doing that now. No, if you don't like it, go, because I need to do this, I want to get past this. And you can't do it without expressing yourself. You can't get past these things without showing these emotions or letting these emotions come out, whether that's in private or whether that's in front of other people. It's got to be done.
So you, in a way, wanted a kind of more honest, revealing, you know, approach where you almost told it how it is, and other people
at the time,
had to face that to some extent.
At the time, I don't think you know. So you go through a really big period of time, it just suddenly hits you one day, where you almost wake up and that's it. The tears start, the woe's me starts, the down in the dumps starts, and you have almost no idea what on earth it's all about. What are you crying about? You just don't know. And you know, several days later you're thinking, what on earth am I sobbing about? Why am I crying? Why am I being hopeless? You know, get a grip of yourself, and it takes such a long time to realise that this is normal, or for somebody to tell you, you know what, this is normal, and it is normal.
What do you see in the future for yourself now?
Oh, everything. Absolutely everything. The future is mine to take, mine to have.
That's good, a good attitude.
It's the only attitude to have.
What does that mean in reality? What are you aiming for?
I haven't got any specific goals, or I don't have any specific goals as such. But up to now, I've changed my life beyond recognition. I've almost used my experience and my cancer and my time off work as an excuse to reinvent my life and to make changes with things you don't like. It's an opportunity, and I've took those opportunities to the extreme, really, where I've sold everything I own, and I've bought a narrowboat, and I now live on a narrowboat, and I've done that in the last 6 months.
Wow, that sounds amazing.
So
that was a decision you made after your diagnosis as a part of a lifestyle choice?
It came about, you have many hours in the day when you are pretty much hopeless and pathetic, can't do a lot, don't have much energy, have little or no enthusiasm, and you find yourself either staring boringly at the TV, not really watching it but it's there, or staring into space, or sitting there rocking yourself in the chair. You know, these things happen, you go through these stages, and sooner or later your brain begins to wake up again. It's several months and your brain begins to wake up again, and little events happen. And for me, one of my closest friends who lived on a narrowboat could see that I was in this hole and I was in this rut and I wasn't coming out of it. So he just turned up one day and I was still in my pyjamas at 3 o'clock in the afternoon, which again is perfectly normal for most people, and said, right, I don't care what you look like. He physically went and grabbed some clothes, he physically dressed me, and he shoved me in the car, he drove me to Nottingham, and he put me on the boat, and off down the River Trent we went. And that's when the little seed was planted, and I thought, I like this is nice. And it was a wonderful day, absolutely fabulous day, and that planted a little seed. So when I got home I started looking at narrowboats for sale, and the seed just got sown, and I thought, you know what, I'm not going back to work for a long time to come. What can I do with myself? What can I do with my life? What do I want with my life? Do I want what I've got now? And you begin to assess everything you have, everything that you've got. Do you enjoy it anymore? Do you want to do it again? All these things. And one day I just made the decision. And I think also because of the situation with work, the financial situation with work, that speeded up the thought process that actually I wanted to make my life more affordable, and I wanted to be in a position where nobody could make me feel financially insecure like that again, to the point of threatening to lose my own home. So that speeded up the process for me for deciding that, you know what, I'm going to give it a go. Total life change. And I like the idea of the freedom of unhooking your boat, starting your engine and chucking off down the river and not having a care in the world. Just me and the wildlife and my little dogs. And that suits me down to the ground.
I'm guessing you wouldn't have been able to do that without having had that experience of the cancer that you had.
I don't think it would have been a thought process that would have developed into very much. You know, we all have the thoughts now and again, oh, that would be quite nice, wouldn't it? Or maybe I could do it as a holiday, or you know, some people want to go and live in another country and it's just something they think about all their life, and occasionally a few people go and do it. It would have been a passing thought, I think. But I allowed it to develop and I allowed it to grow, and I decided that, you know, I didn't want to mow the lawn anymore. You know, I didn't want that responsibility. I didn't want the responsibility of paying the gas bill anymore. I wanted to alleviate some of the responsibilities and stresses of life, because I think when you've had something major like this, you realise how stressful life is, and you realise that, you know, just bringing in a wage, and most of it disappears again in bills, and you think, this is no way of life. You know, I want a life, I want to enjoy life. What do I enjoy about life? I love nature. What better way than going living with it? And our narrowboat is as close to nature as you could possibly live with. I live in a nature reserve now on a narrowboat.
That's amazing.
Can't get any better than that.
Do you think something good, in a sense, has come out of your diagnosis?
Yes, absolutely. Many things, other than deciding to change my lifestyle for something cleaner and healthier and more simple, less stressful. I think choosing to get rid of things that stress you out is absolutely superb, and without having the cancer and the surgery more so, I don't think I would have made that decision. I think you would have just carried on with the flow of the rat race of life. And it's also taught me, although I don't feel I suffered hugely with vanity, I think having been through the freaky looking stage and all these very difficult and very hard to contend with emotions has made me a much stronger person and a much more determined person to do the things in life that you want to do and that make you happy, rather than just letting them pass you by.
Definitely. Well, it's been great hearing about your cancer journey from the very beginning, all those complications after surgery and that big operation, and then your recovery period. It sounds like you're nearly back to a new you that's a good you.
I don't want the old me anymore.
Not necessarily the old
No.
you, but a good new you.
Yes,
I could say
absolutely.
it that way.
Yes.
And so thanks for sharing your story.
You're welcome.
And I wish you all the best for the future.
Thank you.